G'day everyone, this is Health Highlights. Health Highlights is a show about health professionals and the people and the stories behind the names that we often hear about, but we seldom get to meet. And today, we are here at Attune Health Centres interviewing the new GP for Attune, Anthony Weller. How are you, Anthony?
Very well, thank you very much for having me.
Now, firstly, how am I going? Am I going to live?
Well, your arm wasn't straight, but we'll see what the register comes up. I think you'll be fine.
Good. So Anthony is a new GP. He's been moved up from Mildura. He was in Mildura for the last 9 years. He graduated from Newcastle Uni in 2009, and then he's been working down there as a general practitioner and also helping out with many of the students in the Monash University training course for the rural students. But he's very excited to be moving back to Newcastle to join the Attune Health team as an integrated GP. So Anthony, can you firstly tell us, am I going to live?
It says error, but I think you'll be absolutely fine.
Well, that's good. So why general practice, Anthony? Why did you get into the business?
So the main thing was that I enjoyed all aspects of medicine. So there were some things that I was interested in kids. But I just enjoyed so many different aspects of medicine that I knew that general practice was the right answer to be able to do all those things. So that's where I got into.
Wonderful. And so you've been working now for about 10 years, and I've read your bio, and you say that preventative medicine is a really important part of actually what you do. So can you maybe share with everybody, what does that look like to you, preventative medicine?
Yeah, so there's a lot of practical aspects to this as well, and you know, the benefits are very wide reaching, from that aspect of you being one step ahead instead of one step behind in your health. So much better to not leave things to the last minute and present in a bad way. To be able to be one step ahead is much better for all. And we see that on the health system as well. If we can get you healthy and one step ahead, then we're going to have you in hospital less, we're going to get you active and functioning well for longer. I think it's a great thing to aim for.
Absolutely. And so that really does tie into the whole integrated model, doesn't it?
Very much
because
so.
When you're looking at preventative care, then there's other aspects of that care. So how does preventative care and maybe the other integrated model sort of work for you?
Yep. The integrated model is really important to me. One of the things I'm really excited about joining Attune for, that ability to not just refer to the physio or not just refer to the psychologist, but to know that you're collaborating well together, that you're singing from the same hymn page, is really important to me. And to have the professionals here in the building to be able to collaborate with, I think is something that I'm very excited about.
Awesome. And so how does that approach look for you in your everyday work, an integrated approach to general practice? So for example, different clients coming through the door, the way that you interact with practitioners, how would you sort of envisage that looking?
Yep. So we do a lot of collaborative care, and where I'm working and where other people are working, we will send off referrals. I'll send off a referral to the psychologist, I'll send off a referral to the osteopath, I'll send off for a review from a pharmacist who might run through how things are going. And so you are working with other people, but there's that referral space in between. And there's a little bit of a disconnect as a result of that. I think the thing that really stands out about this clinic is the fact that we can all collaborate together, and it's just that we're going to get that more direct communication. And I know that I'll feel the benefits of that, and I know that the clients will be able to see that interaction playing out.
Absolutely. And so I suppose one of the benefits that we see quite a lot of here is that the clients tend to not have to have that battle between different people because everyone's all on the same page. So what can you see about being able to go into, say, a naturopathic consult or go into a physio consult and actually collaborate together? How is that going to really benefit, say, a client who you see in terms of their health pathway?
Yep. So I was thinking of an example for it. So the approach for a 65-year-old gentleman who goes in for a hip replacement because he's got some osteoarthritis is a very different pathway to somebody who has had a fall at the age of a 75-year-old female who's had a fall and has broken their hip and need a hip replacement that way. The referrals might be the same, but the actual pathways that they're going to take are a little bit different. And it's very important for me to get a good understanding of how that works, but it's also lovely for the client to be able to see that I have a program that's tailored towards a rehab after a hip replacement, but I'm otherwise pretty well. Or I've got a very collaborative care that looks at why I'm falling, how are my medications going, what's interacting, that we can actually work together and get everything aligned a lot better, and then take it and function well and live well as a result.
Absolutely. And so there's also a great benefit to just working together and being all in the one location.
Yeah.
So what are you looking forward to most about working with a whole bunch of team around that actual care?
I'm really looking forward to seeing those different pathways play out. And there's so much, I've learnt a lot in 10 years of general practice almost, but there's so much more that I'm going to be able to learn from that direct communication on a regular basis. This is how this program is well suited for this individual client. And again, I think the client will be able to see how well the communication is occurring. And I think it'll be very reassuring for all to know that it's not just a bit of care here and there and there and there, and then we all kind of communicate behind the scenes. There's that direct collaboration. I can see real positive benefits from it.
Is this the way that you feel that medicine and really healthcare needs to go in terms of the future, in terms of really getting better client outcomes?
I think that we see it in the hospital system where somebody comes in acutely unwell.
Yes.
We're very used to that model, that everybody comes together to get that unwell client better. If we can get that out into the community and have exactly the same philosophy, but get it happening in the community, I think you're going to see benefits, including less people acutely unwell in the hospital getting that care there.
Absolutely, absolutely. So one question that we often ask a lot of people is, okay, there's lots of technology, there's lots of science today in our world, but yet we seem to be, might be living longer, but we seem to be getting more chronic diseases and more sickness. What's your take on the reasons that we're maybe getting more chronic illnesses in our community?
Yep. So I think one thing that's very important is that I think we're trying too hard. We're just go all the time. I think there is an aspect of being able to diagnose better, and I think that's a wonderful thing, but we're just trying to fit so much on our limited plates at the moment. I do see that that's having an impact. I don't have a magic solution for it, but at the same time, I think having that holistic care and taking a step back and putting it all into perspective is going to help out.
Yeah, so good. And so 10 years, looking back over that, have you noticed any trends that have changed or any things that have sort of cropped up in terms of conditions that are more prevalent now than, say, maybe even 10 years ago?
Trying to think off the top of my head, the one thing that really jumps out at me though is patient awareness of their own conditions has come a long way.
Dr. Google.
Dr. Google is definitely there. But there's a lot of positive things too, where people are not just, okay, you tell me what's wrong with me, tell me what I need to do, I'll go away, I'll have a crack at it. People are saying, okay, I want to know more about my condition. I've come, with some information that I've gleaned on it as well. And I think that if we end up, at a point where everybody's got good information and we're talking, good conversations about our health and how we can piece everything together, I actually see that as something that is going to enable better outcomes moving forward.
Absolutely, absolutely. So it's a new year, and there's lots of people with lots of New Year's resolutions. What would be your top few tips on being healthy in 2018?
Okay, 5 top tips for being healthier in 2018. There's no rocket science to this, but if we can do it really well, it makes such a difference. Okay, get a good night's sleep. Something so simple, but it's really important. And we all know what happens when we don't get a good night's sleep. Have a healthy, balanced diet. And again, when we're running about, we talked about trying to fit so many things onto our little plate. It's often one that we compromise on. Okay? Keeping hydrated, again, another one that we really feel when we're not putting those pieces together well. And then, being, again, that one step ahead. touching base with people, so that again, if we can do our health checks, if we can check up on our cholesterol or our blood pressure that we're doing. And then the last one is simple but very powerful in that I think, let me just say, do something you love with someone you love. But to take that time where you make time for that positive encounter, and we all know them, that time where you've gone, we finally got around to doing whatever it was, and you walk out of that encounter going, gosh, I'm glad we did that, we need to do that again soon. How are we going to do that better in 2018? And do we need to schedule it in? Do we need to take advantage of our opportunities more? But those positive encounters, we all know we benefit from them. Let's work it into our lives a bit more.
Oh, there you go. That's amazing information. Thank you, Anthony. It has been a pleasure to interview you. If you want to know any more information about Anthony or about what he is doing in integrated medical space, please leave a comment or jump on the Attune website, www.attune.com.au. We would love to help you understand a little bit more about what that looks like. Look, thank you so much for joining us. Have a fantastic day. Remember, at 12:30 Wednesday next week, we'll have another amazing interview for you. Take care. Healing is a gift, health a responsibility. See you later.